As always, we're going to have our nursing forum, and this is a really wonderful opportunity for nurses all over the world to meet each other and talk about continence issues. We'll have our reports from our various committees and hear about some of the work they're doing, in particularly looking at the nurse's role in some of the conservative interventions that we do for continence. And I think nurses will find this a very stimulating afternoon. Coming to the ICS is always very difficult because there's choices to be made, so many wonderful workshops, but I know in my heart I will be going to as many of the conservative therapy sessions because that's really a lot of my work embedded in both my research and in my clinical practice. And there's some great papers coming up in our conservative sessions that are going on. I will also be going to the bowel function sessions as well. More and more in my practice, I see that nurses are dealing with patients who have bowel incontinence as well as urinary incontinence, and it's very important for us to understand that. The next ones that are always of interest to me are around nocturia, and I know there's a urology session on nocturia, and as well some in our conservative sessions as well. Nocturia is an important issue for nurses, and I was really excited to see that there's some work in terms of hospital care of patients and the issue of nocturia when people come into the hospital that we know right now is not particularly well managed or well understood. So I'm very pleased to see this kind of paper on our program. We will be having a state-of-the-art lecture on the urinary microbiome, which I know is a hot topic. We're learning more and more about all those happy little bugs that are supposed to live in our bodies and what kind of changes occur and how this might play a role in this issue of recurrent urinary tract infections that we see in some of our patients. So that one I know I will be attending. Nurses, when they come to ICS, do get a reduced rate to attend. And so I think it's a wonderful opportunity. And I'd just like to encourage people to remember that if you register before the 25th of June, you save even more because that's our early bird. So I hope to see many nurses join us at ICS in Gothenburg.